Hello everyone. I'm Dr. Uma Jadhav, a medical social worker of St. G.S. Medical College and KEM Hospital. Today we have been privileged to have our former head of the department, social service, Mrs. Daksha Javeri madam. I welcome her today we are going to have a small conversation with her as a part of Dr.M.V.L.Kothari chaired medical humanities as a series of interview that medical college is conducting. So welcome ma'am to our program.
Thank you.
We also had been, I would like to state that we also had been privileged to have Madam Daksha Javeri as our former head of the department. She had been instrumental in setting up independent social service department in the year 1994, and she had done a lot of hard work and works across stakeholders to bring into social service department as an independent department. And thereafter the series of medical social workers have been recruited over the years, and they had been doing a good professional services. They are rendering good professional services to the people at large.
Hello everybody. I'm really happy that you have invited me here, and thank you for choosing me for this series of I feel proud of that, and it takes me back to my old days at KEM Hospital. I have been raised with lot of family and societies and cultural ethical values in my family. My father was a businessman, my mother a housewife. I have 3 younger siblings, 1 sister and 2 brothers. I'm proud because I belong to a family who was loving and caring, and that's where I come from. As far as economic part of the family is concerned, I was quite satisfied and happy with everything. But somewhere in the heart of heart, there was a feeling that I should do something for society. What happened was, in 1965, somebody told me that getting an admission in the social work education is very, very challenging, and that's where I stepped in. I gave individual interview, group interview, written test and all that, and then I was selected. And this reminds me of some talk which I had with the faculty. The faculty asked me if I had the boyfriend. So I counter-questioned the faculty of social work, saying that what relation does that have with this admission? So she said, okay, often people get involved in their personal life and they leave the studies halfway, and that was the reason. So I really appreciated that, but I answered her saying that today I don't have boyfriend, but I can't guarantee you for tomorrow, but I can guarantee you for something, that as far as my studies are concerned, I won't leave it halfway at all. That's how I did it. And in 1967, I cleared that. And in 1968, the Bachelor of Social Work, same graduation, was converted into MSW, Master of Social Work, same academic course and all that. So I am considered Master of Social Work because 1967 was the first batch of Bombay University, and then they did consider 67th batch holder, and they gave them the same degree, Master of Social Work. When I entered for 2 to 3 years, I worked in Parsi Charity Organization Liaison Committee. Then I worked in Child Guidance Clinic at Khar. And then in 1970, I got appointed at KEM Hospital. This is also quite hilarious. I remember those days. There were 9 candidates appeared for this interview. I was topping the list, and then I was asked to wait till everybody left. And then Assistant Dean Dr. Redkar, I spoke to him and I asked him which department is he planning to give it to me? So I was told it is blood bank. And then I did not have any general knowledge as to what is Bombay Municipal Corporation and all that. I was lacking all that knowledge, and sir told me nothing doing. I should take up this position, like how a person tells, a father tells the daughter. He kind of forced me or convinced me, I would say, that I should accept that. And he told me that gradually he would give me the different department of my choice. The first day when I entered, and I accepted this position. When I entered the blood bank, there was so much of chaos because professional donors were posing as relative donors, and there it was a big hassle. And that was, the quality of blood was very low, and same blood transfusion, if given to this super speciality or any accident cases, for any reason blood transfusion, that could have and was creating lot of problems. When I entered the department, there was a kind of argument going on in the department because professional donor was posing as relative donor, and somebody asked him to get out from the department and stay outside because he is professional donor. After 15-20 minutes, I also happened to face the same scenario. I realized the person is not a relative donor. I requested him with a lot of respect, please wait outside and we'll talk to you later. During that time, I interviewed the relative, got all the information pertaining to the patient, and I asked them to wait outside. Called the donor, professional donor, so-called professional. That time I had not met, but I could see the puncture on his veins, on the arms. And when he came, he did not know the name of the patient. He could not give any family history, what kind of treatment patient is being offered. He just couldn't. And then the thing was, this set up an example that even professional donors, for whatever reasons they were donating, they should be respected as a humanitarian, on humanitarian ground. And when afterwards I spoke to him and told him why I am not accepting, he was very happy. And then he departed from the department with a cup of coffee. And then that person later did realize that what professional donors are doing is not desirable. And that's how he did withdraw, because after a few months we were knowing who are the regular professional donors, and he did withdraw. This I take it as a educating aspect of my training, and that's where every human, I felt, has the need, but it is we have to respect them, and accordingly change can be brought in the society. After this, I worked in the blood bank for I think about 2 years. We used to go for a lot of blood collection drive and all that. It was a good experience. Then the notion what I had in my mind, that also was cleared by the institution. Then I was put into the medical department. I was there for 6 months, and after that I was given cardiovascular thoracic center. Believe me, cardiovascular thoracic center, I was the probably second social worker, but the earlier social worker, whatever work she may have done, the social work point of view, the department did not have much of a hold on to the treatment or the therapeutic aspect of the treatment. And that's where for 20 years I worked in cardiovascular thoracic center. That was the time when mitral valve replacement, aortic valve replacement was coming up. And this disease was found with the people living in low socioeconomic group and in poverty and living in congested, uncleaned, unhygienic this thing, and that's how they were getting this kind of infection, and they used to come. That was the time the cost of the heart valve was 2,500. But the patients who came to us never even had 5 rupees in their pocket. So the challenge came up as to how to raise fund, and I started contacting charities. I used to go there, give them more talk on what is heart disease, why this fund is required, and why we are looking forward for a qualitative life of people, and how we can work on preventive aspect of it. And gradually, as the time passed, it so happened the most of the charities like Ratan Tata, Dorabji Tata, then Mahalakshmi Charity, Siddhi Vinayak Trust, and many others. There were individual donors also. Then Sanjeevani Trust. They came into being, and it so happened after some years, whenever I referred them the case, they used to feel that when Mrs. Javeri refers a case, she always studies the case very well, and only the deserving people are being given the help. And that's where my first hassle was over by raising. Then it came as to awareness was needed among the people as to why this particular disease is coming up. And so for that, I started holding exhibition on heart disease, and awareness was created. Then I went on to the second level. Those patients who were operated, I used to take them in a group and take their help to the other people who were to be operated. This worked very well, and besides this, I did hold the meetings of relatives, and they were also given education, and this was done in a group. So this was kind of training come therapeutic come prevention part of social work was done during this. 1994, I remember Madam Pragna Pai, Dean of the hospital and the GS Medical College, sent me a message to see her. I went to see her, and I was asked if I can take up the position of a head. So I said there are few people before me, there are seniors and all that, and I was told my answer is needed rather than giving the information. The highest authority, Dean Madam, would definitely know how many people are before me and all that. So I gave my answer saying that I am capable and nothing can stop me if I have the position. And that's how I became in 1994. It was 7th April 1994, and it was the World's Women's Organization, World Health Organization. And that was the day I was given. Believe me, when I got this chair, it was so difficult. Not for any particular reason, because people were used to not having a direct head. We were working under the preventive and social medicine, so there was no direct kind of innovative force to work for the social workers. And that's where it was the biggest challenge for me. It was very hard for me to get the cooperation and the work to be done. But gradually, with respect to all my staff members and their qualification and their lot of whatever experience they have had, I took everything positively, and I did work in this department from 1994 to 2000. In the 1987, if I remember the year correctly, the HIV and AIDS came into being, and it was really very surprising for me that that was the need of the time. And I realized that social worker can do a lot depending on providing services considering the need of the time. And prior to that, I was in USA, and one of the director asked me what is the position of HIV in India. And let me tell you, I was foolish to say, no, our people are God-fearing. We do not have extramarital this. It was really, really very stupid on my part. When I came back here in 1987 after 2-3 months, and there was sudden strike of labor staff in chest medicine department, and I was approached as to what is to be done. And that's where I picked up HIV AIDS training, educational program for the labor staff, for the nursing staff, and for the doctors also. And that's where more effective work. And after doing that, while this work was going on, I realized just doing this work has no meaning. I have to attend to the patients who are here. So I started counseling for HIV cases. I started counseling for the family members, and that's where it gave me lots and lots of more and more venue of opening for the social work of this thing. This shows that in 1994 or probably 1967, I with the help of all my staff members, we published this book, and this book highlights as to how the social workers in the hospital are functioning. This has even highlighted all the 4 major methods of social work: casework, group work, research, and preventive work, rehabilitative work. And this book, only in my tenure, with the help of all the staff members, we could publish it. And believe me, I got donation for first time, and then for some reason that donation was not made available to me. I approached another donor for publishing this, and at that time it was probably, if I correctly remember, it was 1 lakh rupees. And that I raised the donation, got it published, and sent it to all the colleges of social work. And some of the colleges did use this for training the social workers. And that's where I really feel proud, and I feel if we are together, we can do wonderful work. While holding the position of a social work, I used to end up with lots of other problems. Sometimes it so happened the staff may not cooperate. Sometimes for whatever reasons they have. And that's where Madam Lopa Mehta was my consultant, and she always guided me, and she told me I have to look positively and I have to carry on the work. And that's how we could do it until the 1st December 2000. On 1st December 2000, I took voluntary retirement for my family reasons. But what KEM has taught me, I think probably in my life, I would never ever have had learned that. I never knew value of money, because everything whatever I needed, I used to get it in excess. So I had no this. But KEM taught me what is society, what is suffering, and how the suffering can be handled with the qualified knowledge, with open-mindedness, with positive thinking. Challenges do come in the personal life and otherwise also. But this gave me extraordinary experience, and it has given me everything in my life. Today when I walk in KM, I feel so proud, because I feel I am associated, and that's where. Thank you very much for it. No?
Narrate some of the incidences.
Oh, okay. So I would like to say,
See there and do.
okay, as far as the language part of is concerned, I never knew Marathi at all. KM and KM's patient has taught me Marathi language, and that's where I am proud also, and for learning that. And as far as my staff is, I had that time, if I am correctly, I remember, because 19 years have passed ever since I have left this institute, and now year-wise I may not remember the year correctly, but it was a very big challenge. Some of the staff members decided not to cooperate with me for whatever reasons, because maybe they never had head of the department prior and they were finding it difficult to get them associated with somebody and taking the kind of projects through the head of the department was probably to their personality it did not match, and this was the reason. But I never gave it up. Lots of projects I kept, like Vishava, where the relatives used to have their lunch. That was transformed into a kind of a conference room for the social work, and many other changes were brought in that. And all the time, not only patients, but patients' relatives also were given more opportunity to come closer to the Department of Social Work. I remember in 1993, one of the young child of maybe of 7 years had come to me for the financial help for ASD closure, and that girl, she was helped, she was operated, everything went smoothly, family also felt very happy with that. And same girl after 10 years approached me in social service department. She came from Pune without informing her family and landed up in Ward 31. And when I came to my office, I was told somebody is waiting for me in Ward 31, and that lady had come on a previous night. I went to see her. She gave me a hug and she told me she remembers me a lot. And then when I asked her what was the reason she came down to KF, and she said she has marital conflict and she decided to consult me, and that's where she came without informing her family, in her husband in Pune and her parents in Mumbai. They were living in Sion, and in that case I called the family. I gave a lot of counseling session to this girl, and reconciliation was done. And this is where, if I had said, okay, your work was the surgery which is done, now everything, I cannot do anything more than that. But I felt no, wherever I can, I should be trying to help people. So this is one thing. Another case I remember, a child who was to go for open heart surgery came to my department. There was a long line of patients waiting to see me, and this child just dashed into my office and said की त्यांनी मला विचारले की मला अक्कल आहेत की नाही. तर मी विचारले कशा करता अक्कल. तर म्हणे माझी आई आजारी आहे, मी इकडे सगळं पेशंटना बघते पण त्याची आईला मी बघत नाही. म्हणजे मला जरा आश्चर्य वाटलं. म्हटले की मी काय करू शकते आणि काय झालं तुझी आईला. म्हणे माझं ऑपरेशन आहे, माझी आईला कोण बघणार आणि तिला ताप येते तर तिला मदत हवं आहे. And that's where even the small child could get that concept of help from a particular department was a very big thing. I did speak to his mother, and whatever was needed, I did do it for them. Besides that, at one time there was an image, the head of the department has to be little strong, stout and all that. One person came to see me and asked me if I am Mrs. Javeri. I said yes. So he said, no, I can't be Mrs. Javeri. I said, you please go out, ask others and find out whether I am the same person or not. He said, अरे तुम्ही इतके बारीक दिसतात, तुम्ही हेड असूच शकत नाही. So I said, I do not have answer for this. And this was quite an amazing experience. Besides that, I mean, if I speak on my experience, it would be kind of it would go on and on and on. But some of the cases I just cannot get over. I was holding one meeting in my department, and one gentleman, just dashed in. So I requested him to wait outside for some time. He said he just cannot wait. I said I have no option for that. He has to wait till the meeting gets over. When meeting got over, it took him in my office, and he was so upset because he had HIV positive report in his pocket, and more than this, he cried such a lot because this report was seen by his daughter. So this is where multifaceted task and multifaceted training aspect of social work comes into the picture, and that's where I did counsel this gentleman. And then there was some question pertaining to his wife's health, and I asked him, okay, how is his wife doing? So he tells me, अरे आपको कुछ अक्ल है कि नहीं? मुझे है तो मेरी वाइफ को तो ज़रूर होगा ही ना. So all these things, I became more and more sensitive to the body language, the language person speaks, all this. And today what I am, it's all thanks to my training and my education. And the counseling has become part and parcel of my personality. That's where I think I feel very happy that I could be of help to anyone, and if that is there, but I am a great help to myself. Positive thinking, the way to help, how to help with scientific knowledge. This probably I wouldn't have been able to do it just like that, but because of professional training at post graduation level, I could achieve this. Besides this, I still
professional development, what you have done for the department, case presentation, and you invited multidisciplinary surgeons and physicians, and you have involved them in the clinical presentation. So you used to conduct this clinical presentation, which has in the long run had helped professionals
yes.
To deliver better services.
So this was another this thing, that I wasn't just dealing with the patient's relative and all that. Whenever the need was there, I did conduct awareness classes for nursing and all that. Besides that, for training of social work, number of students during my regime were being placed from the Institute of Social Work for training purpose, and that's where during the training these students were given lots of projects for training them for awareness, lot of script, a lot of dramatic these things were also conducted to make them learn and make others also learn about the particular disease, how it is to be handled, and what are the prevention and therapeutic and rehabilitation aspects of that. Besides that, even we were having periodical meetings of the staff to get feedback from them as to what do they want from social work department. And even we had conducted some best ward awards where social worker playing a lot of role in interviewing the staff of the wards and trying to find out how best the ward staff can help the patient, and that's where some ward were even given the trophy for best ward award and all that. Besides that, best social workers award also was there, and I myself was given the best social workers award, and besides that I was even awarded for best head of the department's award also. And Mrs. Uma Jadhav at one time was associated with me, and I still remember that we had gone to give a community awareness lecture somewhere in Safala on HIV, and that's where she was with me. We had made lots of posters on every different disease, whichever social worker's specialty. Like neurology will have a different way to present their exhibition format and all that. So psychiatry, orthopedic, medical, blood bank. So this is how each social workers contributed for playing a great role in awareness, come treatment, come therapeutic reasons. And that's where I feel I would give credit to my staff also, that in the beginning some had difficulty, but overall it is said that united we stand and divided we fall, and we were united, and I felt proud. I wouldn't have decided to leave. I took voluntary retirement for my family reasons, and I even today doing anything for KEM Hospital, I feel it would be an honor. I'm part of it, and what KEM has taught me, there is no way I can put it in a word, and that's where I am today.
Something about clinical meets that you used to organize for the professional social workers. Could you elaborate on that?
Professional meets also, lot of professional meets were organized. We used to have lecturer from the teaching institute and make the social worker present their case, and then that used to be discussed among that clinical meeting, and that's how the other social workers would become aware of what is happening in a particular department. This reminds me of one of the case of OBGYN. One person, they were one male and female, they were lovers. They got married in temple. According to them, they said they got married, and then lady became pregnant. She delivered a baby girl, and the couple decided to give up the child, and that's where lot of counseling with my help was done by the OBGYN social worker with that patient, and both the couple were motivated to accept the child because they used to like each other, but they had problems with the family's acceptance, and that's where they were helped to first accept the baby, talk to their families. We also participated in that family meeting and all that, and the result was they got the approval of the family, and they got married once again after having baby, and they accepted the baby. Isn't this a very big thing? The child, in spite of having father and mother, would have been either given for adoption, or I do not know what could have happened. But this reconciliation, and we do not do anything by saying, okay, this is good for you and that is bad. But we work with their feeling level, we help them to change their attitude, we modify their thinking, and that's how the social work department is a change promoter. And that's where I proudly say, okay, I belong to this department, and this is endless. Whatever work we do, there is no limit to it. And I wish and pray all social workers in the field and who are getting trained should have the positive way of taking the challenges, and that's where we would be a more effective people in bringing change in the society as and when needed for any reasons. thank you so much for inviting me today. And I have no words to express my feelings for this, but I feel really proud. And I would definitely, I have promised to myself, as and when needed, I would definitely play an important part in the society for any social problem. Thank you very much.
Thank you.
I sincerely thank you for taking out your precious time and sharing your experiences about the professional social work, the role that you played, very important role that you have played at St. G.S. Medical College and KM Hospital, and contributed a lot to the professional social work, to the welfare of the humanity of our population.
I will add up one thing here. My interviewer, Uma Jadhav, at one time was part of my social work team, and that's where I had taken a lot of her help in conducting exhibitions and all that, and that's how we work together. And today I feel happy that she has really experienced as to how the department grew. That was her experience, and today I am being interviewed by her. I feel happy about it, and thank you, Ma.
Thanks, sir.
Very nice.
Right?
Kutu kutu doing that.